We have to find real solutions, and this is Bending the Trend. Hello, welcome back to Bending the Trend with your host, Norm Volsky. And today we are thrilled to be joined by Brooks Deibele. Brooks, welcome to the pod.
Thanks, Norm. Great to be here.
Awesome. And for all of our viewers and listeners that are not as familiar with Brooks, he is the EVP and runs all employee benefits over at Holmes Murphy. So we're really excited to have you, and thanks for joining.
Yeah, again, thanks for having me, Norm.
Just want you to know the gloves are to fight rising healthcare costs, which I know we're on the same side of. So we're working together, fighting on the same team. So Brooks, we'll jump right into it. You and Holmes Murphy have great clients all over the country. What are some digital health solutions that you have launched with some of your nicest, most strategic clients that you've really been impressed by and would recommend to others in the space?
Yeah, absolutely. Well, first of all, thanks for having me on, Norm. Love it. Love that the gloves are on. And yeah, I'll start off by saying, so first of all, I'm a firm believer there is no single vendor that's a fit for all or even most employers. You really got to start by really understanding the data, organizational culture, goals of the organization, leadership team, core values, et cetera. And then, of course, the size and the funding of the organization is going to play a significant part in that as well. That said, who you pick for your partners is critically important. And, the contracts that you have with them are really equally as important. And, you're always starting out with the TPA and the PBM as really kind of the big rocks. But for this purpose, I think what I'll focus on is maybe some point solutions that I see that are falling into areas that are really at the top of the list for many employers. And you probably hear a lot about direct primary care and different opportunities in that particular space. And we're traditionally, with the vast majority of our clients, we're working with them to ensure that they have a strategy in that particular space. And a lot of it is really driven by local dynamics and the footprint of the client and all of that. But I'll maybe focus on a couple that, we have layered on consistently with a lot of our multi-state employers in that virtual space that we're getting really good satisfaction from, and we feel like reasonable ROIs as well. We have many clients and have had good experience with both Teladoc and Galileo's virtual primary care programs.
Fantastic.
Yeah. So that's really in kind of that virtual primary care space. We think a strategy there obviously makes a lot of sense. And then you got the big areas of spend like musculoskeletal and cancer care as well. We've long been fans of it, of many clients that have leveraged Hinge Health for MSK. And, I'll say, the savings, they're real in that space when the adoption is strong. And, the vendor Hinge, as an example, or other vendors in this space, replace traditional care in that space, not layer on top of it. Hinge has been one that we've had good success with, both from a member experience standpoint and from an ROI perspective as well. On the cancer side of things, almost every time you're sitting down doing a claims review with a client, and cancer is emerging as a bigger and bigger area of spend, and it's an area that our clients really want to solve for. And we've had good success, from an experience and from a results standpoint with color in that particular space as well.
I love it.
Yeah, and maybe the last one I touch on is weight loss. Obesity continues to be, an area of concern and interest for our clients as well. And there are a lot of solutions that are emerging in this space, the Vertas of the world, et cetera. We've seen a lot of interest and had a lot of good discussion, dialogue with our clients, and have several moving forward with Onsera, who is a new player in this space as well, really focusing on the obesity crisis that we have, across our country.
Very cool. Well, I'm glad the first thing you mentioned was DPC, because I'm a huge believer in, if you can't control the referral, you can't control cost. And 100%. By having a DPC that isn't affiliated with a large health system, they have no incentive to refer to certain departments that just happen to be high margin of that health system if they have no affiliation and they have no conflict of interest there. So I think like any employer strategy that doesn't have DPC is kind of like table stakes. You're also almost missing the mark, and they can kind of be the point guard and point you to other benefits within your health plan that are high value, low cost, and that also like hit the clinical quality marks to be able to, not only save money for the employer, but I think, employees, like you want them to not have to go out of pocket. So their hard-earned dollars are able to be spent on things that they actually get value out of and isn't just a drain, on their paycheck. So I really, really love that. Walk me through any like data or any success stories with these vendors where you're like, hey, it's not just like a nice to have and, yeah, employees like it, but like any statistics or improvements in either clinical quality outcomes or cost that you're seeing as like the result of implementing these programs.
Yeah, I mean, so I'd say that gone are the days of just putting in programs because they sound great. In every case now, employers want to know and feel confident that there's going to be an ROI, and it always starts with, at a bare minimum, having a one-to-one ROI. We're talking about a lot of new vendors that have emerged in this space, some of which have a much longer track record than others. And I would say the member experience and the testimonials you get are extremely important, but I mean, we're evaluating vendors, we want to see at least a 2-to-1 ROI. And in many cases, particularly for, if you're looking at like the virtual primary care space, in the year one, it may be a 1-to-1 ROI, but we would expect in what we see in kind of years 2 through 4, more anywhere from a 2 to 4 times ROI. Similar.
It only compounds over time because if you're having a strong DPC strategy, and you're having more people participate in DPC, that primary care physician is telling them, here's your risks, here's some behavior change I'd like to see. If that meeting never happens, nothing downstream gets improved. So that totally makes sense that like DPC is such a strong investment because what you prevent today, you see the benefits of, years and years later, and it compounds over time.
Yeah, absolutely.
I like that. Any other success stories with either Hinge or Ansera or any of the other vendors that you mentioned that are more point solution as opposed to DPC?
Yeah, Ansera's newer, so I think time will tell in that particular case. But if we look at like in the instance of Color or
Hinge. Yep.
Hinge in those scenarios, I mean, these are areas of significant concern for our clients and significant opportunity as well. And we're routinely seeing that we're getting 2 times ROI or more in those particular cases.
And I assume it's from Hinge's standpoint, reduced amount of surgeries. And then on the Color side, it's earlier detection and intervention. So you're catching things at stage, ideally 0, 1, not 3 or 4, and catching it earlier. And then there's a tailwind on the back end of it being a hell of a lot cheaper to treat early than late.
Early detection is huge in that particular space, but also, reducing gaps in care as well. Having a better treatment plan, providing better support also contributes to the ROI in that particular case.
I love it. You've been around the industry for a very long time. You've seen probably just everything under the sun over the last decade kind of proliferate within digital health. What doesn't exist that you wish did?
Yeah, one of the things that I always come back to is I wish there was more choice at the member level within employer group plans, right? So, you have large employers or even mid-sized employers that are trying to create plan designs, put together networks, select all the vendors for a workplace that has multiple generations in different locations. So it's a little frustrating to me that we're still at a point where, a member can't pull various levers to determine what works for them and their family, whether it's deductibles, co-pays, the network that they choose, some of the bolt-on solutions that they have as well. So there's very different needs across the workforce. And, private exchanges, they were supposed to solve for some of this. We don't hear much about private exchanges anymore in the group space, and there's limitations there. ICRAs, on the surface, they sound great. And candidly, they are a great solution for many employers that are really looking to get out of the risk business, so to speak. But let's be honest, I mean, the individual market as it stands today, I mean, there's very little flexibility and the plan designs aren't great. The networks that you get to choose from are not great. Solving for service issues at times when something exists, that's not great. So at the heart of it, I'd love to see more member choice within the group health plan space.
Yeah, and I think some of that comes with a lot of the vendors in our space to be a little bit more creative in their pricing. Do it on case rate, do it on utilization, take a percentage of cost savings, go at risk or value-based on some of your pricing and modeling so that an employer can embed you in their system. And if people are looking for that typical service, they can find it easily and simply. So really excited about that. Last question, who are you nominating next to get in the ring with us? And who do you think scours the market and their insights and opinions would be, benefit to the whole industry to hear what they've seen work?
Yeah, that's a good one. And right off the top of my head, there are a bunch of names that come to mind that I believe are, brilliant minds in this space. The one that I'm gonna tell you about is Sean Mobley, and Sean's somebody that I have a long history with. I go back to the days at United Healthcare when Sean was working in the national account space, but he's spent the last, I'd say, decade plus in the digital health space, advising many digital health companies, working directly for many digital health companies. And I think Sean would be a very interesting person and somebody that your audience would get a lot from if you had him on the podcast.
Love it. We will reach out and we'll get him scheduled. So thank you so much, Brooks. Appreciate all you do with your group over at Holmes Murphy for the entire industry, and keep up the great work. Thanks for the advice and the recommendations, and keep fighting the good fight.
All right. Thanks, Norm. Appreciate all you do.
Thanks. Take care. Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.